The second poster that I presented at ASHA was with the Specialty Board for Fluency Disorders. So the Specialty Board on Fluency Disorders is a board that oversees the training of board-recognized specialists in fluency disorders. So after speech-language pathologist, finish school, do a clinical fellowship year, and are fully practicing clinicians, within our profession, you can actually apply to become a board-recognized specialist in fluency disorders. And then you can have that after your name and become be on a list of other professionals that also have attained that. There's a whole process. You need to do many continuing education credits to learn more and more about the new research and new information about treatment of stuttering. You have to be mentored through the process by somebody who is board recognized already. You have to submit a pretty extensive portfolio showing observation of other board recognized specialists treating children and adults and preschoolers who stutter, as well as you working with clients who stutter, and submitting video samples as well. And the board that I'm on actually reviews those and gives feedback, and it's a peer review process too. After your portfolio is accepted, you take a test, and if you pass that test, then you're able to get board recognition in fluency disorders. So this poster was actually polling the board recognized specialists that are out there, and there's just about 200, a little more than 200 in the United States at this point. We're trying to grow that number. We're trying to increase awareness among consumers as well as professionals, other speech and language pathologists that have not even heard of board recognized specialists in fluency disorders. So we're trying to educate the consumers as well as speech pathologists in our field. And the survey that was done of the board recognized specialists in fluency disorders showed that a lot of people who are board recognized are not mentoring, and so we need to get more people involved in mentoring so that we can have more board recognized specialists out there. And it also showed that there's a lack of knowledge about board recognized specialists in the consumers as well as within our own field. So that's just showing us that we have a lot of work cut out to do, and we were able to talk to people who came by to look at the poster about that and educate people about how to become a board recognized specialist. And the whole point of board recognition is to get quality therapy for people who stutter, and to be able to identify who those clinicians are, and put them in touch to consult with other clinicians or to work directly with people who stutter.